Nockowitz. How are you?
Good.
This is Ceyanna. She just recently transferred here from Lincoln, Nebraska to Ashland University. And this has been her third day in the shelter. And she's feeling very anxious.
Okay, Ceyanna.
She had a seizure on the third night she was here. It was disoriented. Her heart rate's 90, blood pressure's 110/60, respiration's 25, SpO2 99%, and her temperature's 99 degrees. She says she feels nauseated, anxious, kind of confused, and she's asking for some alcohol.
Okay, Ceyanna, have you ever had seizures before? Okay. Well, this is the first time you've ever had a seizure.
I don't remember having a seizure.
Okay, the nurse did say that you had a seizure on the third night, which would be, well, you said it was the third day in the shelter, but you mean last night she had a seizure?
Yes, they found her balled up on her cot, confused, couldn't remember what happened.
Okay. Ceyanna, your anxiety that you're having now, is that something you've had before coming to the shelter, or is that something you made here?
Recent.
Okay. Do you have any family history of people having anxiety or panic attacks or any other psychiatric illnesses? Okay. And you yourself, have you ever seen a psychiatrist or been hospitalized for mental health issues or on any medications for anything like that? Okay. Do you use any alcohol or drugs?
Yes.
Okay, tell me a little bit about that. What kinds of things do you use and when did you last use them?
I drink 3 beers a night before the show.
Okay, three beers a night, and do you use any other kinds of substances or drugs?
No.
Okay, how big are the beers?
Normal cans.
Okay, do you sometimes have more than 3?
Yes.
Okay, on some nights, how many can you have? Up to how many?
7.
Okay. How many nights of the week do you think you have more than 3 beers?
Which one? I don't know. Yep.
Is it maybe like 2 or 3 nights a week, or more like 4 or 5 nights a week that you have more than 3 beers?
4.
Okay. Okay. So, are you on any medication for any medical conditions?
No.
All right. Do you have any medical conditions that you know of?
No.
All right. Have you had any head injuries in the past? I know you said you had no seizures, but how about like a head injury where you got knocked out?
No. Not that I remember.
Okay. All right, well, it sounds very likely, Ceyanna, that probably have a seizure from not having the alcohol that you usually have, you know, every day when you're 2 to 3 days or so after not getting alcohol. If you drink it every day, you can have a seizure like that. And the confusion and the nausea and just the bad feeling that you have right now is from the seizure you had last night. So we really want to keep a close eye on you and make sure that you don't have more seizures or go into any more symptoms of withdrawal. You don't look very shaky right now, and your vital signs look okay, so that's reassuring. But sometimes even up to a week, you know, people's withdrawal symptoms can get worse, and you can start to get shaky and more confused, and even have another seizure. So, you know, it sounds like your problem is alcohol sort of dependence, where you're using it every day and then not having it for a few days, for 5 days. Kind of went through a little bit of not too much alcohol.
You broke up there for a minute.
Sorry. Do you think you have a problem with using too much alcohol?
No.
Has anybody told you that you need to cut down on your drinking?
Yes.
Yeah. Do you feel annoyed when people tell you that?
Yes.
Yeah.
How old were
Do
you
you
when
feel
you
guilty about that?
Yes.
How
Yeah.
old were you when
Do
you
you ever
started?
need to drink sometimes in the morning in order to feel better and not to feel shaky?
Yes.
Okay. Yeah, those questions I just asked you are more questions that assess how much somebody's body is dependent on alcohol. And, you know, it sounds like you are. And it's something that once you get out of the shelter, you know, you should probably talk to somebody about and get some help for it. And while you're here in the shelter, we're going to make sure and keep a real close eye on you and take care of you and give you any medication you might need. You might need some medicine to make sure that you don't have shakes or withdrawal or have other seizures. Right now you're looking okay, but we're going to keep a very close eye on you. Does that make sense to you, everything that I'm explaining? Yeah. Do you have any questions for me about any of that?
No.
Okay, Ceyanna, well, if you need anything, we're here for you. We have medical staff, the nurse that's with you right now. We're going to make sure that you get through this all right, and that you get the help you need after you leave here as well, okay? All right. It's really nice meeting you.
Thank you. There you go. Thank you.